All right, part 2 for us. So once you think your patient has learned that pattern of the hip hinge, we can start now to introduce load. When I introduce load, I need to make sure that I'm starting more of an elevated surface, because sometimes you can introduce load and you think the form's correctly, but when you give the load, they do something incorrectly and get hurt. So what I want to do first is I want to bring in a 6-inch box to decrease the height or decrease the distance in which they're going to the floor. So we're just going to step over this box so the box is directly underneath her. I want to start with something pretty tall. So usually I start either with a bigger linked kettlebell or a vertical dumbbell. So you're going to see on my box over here, if you take a quick look, I have a circle in the center of the box, and that's where I want that dumbbell to be. In order to really work in that hinge pattern, you want to make sure that wherever you have the load needs to be directly underneath your patient. So Avery's actually going to step forward so she is over the kettlebell. What this is going to do, it's going to force her to go backwards with her hips to grab the weight, because the weight is directly underneath her. If the weight was in front of her, she'd probably squat down to grab the weight. So now, same cues we did before. She's going to put her weight through her heels. She's going to push her hips back. She wants to keep those 3 points of contact. And we have the wooden dowel here, so a nice straight spine. Hips go back, soft knee. She's going to grab the weight here. Now she's going to push off her heels and extend her hips into the weight. She's then going to go down, aim for that circle in the box, come up, get full extension, and you're going to hold on to that weight the whole time. You're going to do 3 or 4 repetitions, okay? Good, so Avery goes down, she's going to tap the box, come up. Good, and really working on pushing those hips away. Good, right? Keep going, Avery. And Avery's going to make sure she finishes with full extension. So a lot of people won't do this. So if you take a picture from Avery from the side, you can see when she comes up, Avery doesn't like to get into full extension. So people get extension through the ankle and knee, but they'll fail to get full extension through their hip and back. So Avery has to finish here. And that's a big cue. If you think about telling your client or patient to really squeeze their glutes, we use a cue of cracking a walnut with your butt, which sounds a little weird. You can say pinch a piece of paper. That will help Avery get completely locked out. So Avery's going to go again. She's going to push back, come up. She's going to complete extension. Much better, Avery. Good. Put that weight right down. And sometimes holding a dumbbell like that, your patient won't feel like they can get full extension because that is riding in front of their hips. So we can introduce something a little bit different. We can introduce dumbbells to the side, or we can introduce something smaller in front. Please remember, if you bring in a load and you still feel like you're not getting form, you can always go back and put those plate weights on the toes, or you can introduce that band again to pull that hip back. So we're going to do first, to change Avery's load up a little bit, is I'm going to get something a little bit smaller. So I'm going to put it here, and that's going to force Avery to bend a little bit deeper into the motion. So Avery's going to go down and grab her kettlebell. And what I might do here, go back down again, Avery. I might tell my patient to stay there before they lift. So go down and grab the top. And if they stay there, I can check their form right now. I can say, all right, shift your weight back through your heels. You have a flat back, your chest is out. Avery's form looks pretty decent. Don't pick up yet, please. So Avery, go back down in that good form. Chest out, there's her flat back. What's gonna happen here, she's gonna push through her heels and then drive her hips forward. Go, Avery, squeeze the glutes, go back down. She taps there, comes right back up. And see how good that looks? A few more reps, Avery. Good, nice job. One more time. Good, right down, you can let the weight go. So now we know that your patient can go down to an elevated box and they're keeping pretty good form. What I want to do now is I want to take the box away and go to full depth. When I go to full depth, I'll probably bring back that vertical dumbbell because it's still getting a little bit deeper, but not as deep as we possibly can get yet. So Avery's gonna go down, she can put her hands on the dumbbell. I'm gonna have her hold it there just for a second so I can check her form. It looks pretty good. Now she can drive off her heels, squeeze her glutes, come forward. Now she's gonna push her hips away, go down, good, squeeze her glutes, come forward. One more time, Avery. Good, then you place the dumbbell on the ground. Awesome, Avery. Good, relax right there. So now we already saw, I can go down from a box, I can go to a kettlebell to a box, and now I can go down to that ground and tap the ground with the dumbbell. If you want to progress this a little bit harder, I can start to bring in more load and not allow that quick release. So no touch on the ground that allows the body to relax. So now Avery's going to go down and grab the 2 kettlebells. She's going to come up, squeeze her hips. And now when she comes down, I only want the kettlebells to get to shin height. They're not going to touch the ground. So Avery's going to push the hips back, get to shin height, come up, squeeze the glutes, do 3 more of those, Avery. Good, one more, Avery. Good, and Avery could probably get a little bit deeper, but that's something you'll work on. Be very careful now that we have load. When your patient is done, make sure they put the weight down in proper form. You'll see a lot of your patients when they finish up, they're gonna have the weight in their hand, they're gonna finish that last repetition, and they're gonna flex their spine as they put the weight down. And that's something we don't wanna get the habit of because obviously they can hurt their back with that. So those are two really quick, easy ways to load in that hinge position. But if you notice, we're still doing a lot of bilateral movement. What I wanna show you next is a couple quick progressions and more of a unilateral motion.